Hello, this is Dr. Sasan Kodabash, and I often get asked, why do dental implants fail? Although that dental implants have a 95 to 98% success rate at our facility, and that's pretty common nationwide, they do sometimes fail. And sometimes we never really know. But usually we can categorize that into three common areas, okay? The first area is health history. How healthy is the patient? If a patient who comes into our office, 35-year-old healthy male or female, with no pre-existing conditions, usually tend to have a much higher success rate. They're tending to be in the 98th percentile, okay? Now, if a person who comes to our office, uncontrolled diabetes, immunosuppression through chemotherapy, for example, or a patient who has a history of being a smoker for the last 10, 20 years, they tend to have a lower success rate, usually in the 70 to 85 percentile. One of the other main reasons of why implants can fail is mechanical stress placed on the dental implant. Now, a dental implant has three components. Usually you have the implant component, which is the actual screw that's inside of the bone once it's placed. You have what's called an abutment, which is a connection between the implant and the restoration, such as a crown. And then you have the crown itself that goes over the abutment. The crown usually is either cemented or screw retained. In our office, we usually like to have them screw retained because they're healthier and they last longer. So those are common reasons why they can fail. If one of those parts, stress is placed on them, that's too great. You get to see some bone loss around the implant, for example, or one of the screws, like the connection between the implant abutment and the implant itself, can fail. So we want to account for all of this before we do the surgery to make sure that we have a great result and a great outcome for the patient. Last but not least, the patient's oral hygiene. When they come into our office, if they have advanced bone loss, if they have poor oral hygiene, we want to discuss with the patient, what is causing that poor oral hygiene? Is it just lack of brushing, lack of flossing their teeth, or is there just something else going on? So those are discussions we want to have with them before we do any type of surgery, because just like the patient, we want this to have a high success rate. Once you have an implant placed and you have it restored, requires a lot higher maintenance than just having your own natural teeth, because you can still get plaque around the implant restoration, and we want to make sure that that is addressed. So we discuss all of this with the patient ahead of time. If you have more questions, please visit our website at summitpointdental.com, or feel free to give us a call to schedule for a free consultation.